Hi, I'm Rachel Lampert, the Editor-in-Chief of the CardioSource Cardiac Rhythm Management Clinical Community. Here with me today I have Dr. Mark Link of Tufts University, who's been doing some work with arrhythmias and air pollution. Mark, tell us about what you've been looking at, what kind of pollution, what kind of patients?
Yeah, we started this project probably 12 years ago now, looking at the association of air quality with triggering of arrhythmias in patients with defibrillators. And we did first a retrospective study for 5 years, and now we've been on a prospective study for the last 5 years.
And what kind of pollution have you been looking at? How have you been following this?
We look at 6 or 7 different types of pollution, basically split between particulate matter and gaseous matter. So the biggest particulate matter we look at is PM 2.5, which is particulate matter less than 2.5 microns.
And is this pollution we encounter in our daily lives? Where does it come from?
Yeah, most of the particulate matter in the world's environment comes from burning of fossil fuels, so gasoline, diesel, coal. And so in the Northeast, most of the particulate matter is from both coal and cars.
So what have you been finding?
So what we found is that acute increases in air pollution, especially particulate matter 2.5, will trigger both atrial and ventricular arrhythmias. The atrial arrhythmia trigger starts as soon as 2 hours after the rise in air pollution and peaks at probably 6 to 12 hours. And the ventricular arrhythmias start at 2 hours, but really peak at 24 to 48 hours after an increase in air pollution.
Now, who are you looking at? Is this everyone or people with particular vulnerabilities?
No, we use as our patient population is patients with defibrillators, so they are particularly more susceptible to ventricular and atrial arrhythmias than other patient populations. But we use this population because the defibrillator automatically logs the date, the time, and the second of the arrhythmia, and that means we can correlate it very closely with hourly measurements of pollution. And
so do you think there are some people are particularly vulnerable to these types of arrhythmias, or what might be the mechanisms?
I think there's a potential number of mechanisms. I think certainly an inflammatory response occurs in the lungs when you have an increase in air pollution. I think there's probably ischemia that also occurs in the heart. And I think it's this combination of inflammatory increases and ischemia that causes the increase in arrhythmias.
And what do you think, what should we take away from this? What should patients, clinicians, maybe regulatory institutions, what should we be thinking about with this data?
Well, it's amazing in Boston, which is a relatively clean air city, that even small increases in air quality, air pollution will trigger atrial and ventricular arrhythmias. And this has got to be magnified many, many times in cities with much dirtier air. And so I think the take-home message is that if you're a patient and it's a dirty air day, that you should stay inside. And I think from a regulatory standpoint, we should not be making our regulatory agencies more crippled. We should actually be making air pollution standards more stringent rather than relaxing them.
Yeah, I think this is some pretty important data pointing us in that direction. Thanks very much.
Thank you, Rachel.